it is stomach and beginning of duodenum. And between liver and stomach it is this part of Omentum which starts from liver and goes to stomach, that is hepatogastric ligament, and it is hepatoduodenal ligament. And together, all of this place has name Omentum. And great omentum starts from greater cavity of the stomach and goes downward, attached to transverse colon, and in space between transverse colon and stomach it is ligamentum gastrocolicum. What is it? Stomach. It is esophagus. It is cardiac ostium, and nearest part is cardiac part. What is this part of the stomach? Fornix of fundus. This part is pyloric part. And this one is lesser cavity, and it is greater cavity. This peritoneum is broken, but if we join together, it is between liver and stomach, this ligament, hepatogastric ligament, and it is hepatoduodenal ligament. And together, that is lesser omentum. This one is great omentum. It starts from stomach and goes and fused with transverse colon, and in space between stomach and colon, that is gastrocolic ligament, and whole this structure, that is great omentum. Now, that is beginning of duodenum, pars superior duodeni. Then impossible to see the ascendants and horizontal part because they are behind of peritoneum. No, it is horizontal and ascendant part. And now place where duodenum continues into jejunum, that is flexura duodenojejunales. It is clear to see because we can see mesenterium. Look here, that is mesenterium. Peritoneum goes to jejunum and ileum and makes mesentery. In place where mesentery start, that is beginning of mesentery. That is flexura duodena jejunalis. And this ligament which is fixed, flexura duodena jejunalis, that is ligamentum suspensorium duodeni, or Treitz ligament. That is jejunum, and jejunum continues into ileum. There is no clear border. Just we know that superiorly and on the left side jejunum, inferiorly and on the right side that is ileum. But where is a border between them, impossible to find. That is mesentery, that is small intestine, intraperitoneal position, everywhere circular ligaments, everywhere villi intestinalis. But main differences between jejunum and ileum: presence, pairs notches, folliculi, lymphoidei, aggregates follicles in ileum. Small differences, large diameter in jejunum, thicker wall in jejunum, more numerous villi intestinalis in jejunum, more better blood supply is the same in jejunum. That is all. In place where ileum insert into the cecum, into large intestine, we have ileocecal valve, valva ileocecalis, Any questions? Okay. that is superior part of duodenum. What is above of this part? Superiorly liver. Then look here, that is pancreas. That is a pancreas. And duodenum surround head of the pancreas. Head of the pancreas is surround with the help of duodenum, and duodenum fused with the help of pancreas. That is why if we speak about topography of descendants part of duodenum, medially that is head of the pancreas, posteriorly that is right kidney with adrenal gland, in front that is transverse colon with mesocolon, that is mesentery of transverse colon. Something else? Well, we come here one again when I will explain large intestine today. Goes to stomach, that is the stomach. And these two layers of peritoneum goes to stomach and surround stomach in front and behind and continues into greater omentum. And this one anterior layer and one posterior layer together makes ligament. Hepatogastric ligament, that is hepatogastric ligament and hepatoduodenal ligament. Both of them consist of anterior and posterior layers of duodenum, of peritoneum, and here is between these two layers we have fat tissue, some vessels and nerves, lymph nodes, lymphatic vessels, that is between these two layers of peritoneum. Yes, two layers. And that is less omentum.
When ligaments are present, there will be peritoneum. No.
One again.
When ligaments are present between the organs, there will be peritoneum layer.
In all cases, a ligament that is peritoneum, but some ligaments has one layer of peritoneum. For example, here it is between liver and duodenum and diaphragm. In midline between diaphragm and liver we have falciform ligament. It consists of two layers of peritoneum, but posteriorly, here it is posteriorly, peritoneum continues to the liver and only one layer of peritoneum here, and far from this place another layer. That is triangular ligament. It has only one layer of peritoneum. That is why some ligaments consist of two layers of peritoneum, in lesser omentum, in greater omentum, two layers of peritoneum. Sometimes maybe only one layer of peritoneum continues to inner organ. That is, in this case, we speak about primary and secondary ligaments of inner organs. Primary ligaments consist of two layers. Secondary ligaments consist of one layer of peritoneum. Well, understanding, not necessary to draw. Terminal part of small intestine, that is ileum. Ileum insert into the cecum, that is blind part of large intestine. It has vermiform process, appendix vermiformis. And that is first part of large intestine. In Latin, large intestine, that is intestinum crassum. Ceacum, that is ceacum in Latin, or Greek name is typhlon. That is why inflammation, typhlitis, inflammation of ceacum. Next part of large intestine, that is colon. And colon consists of ascendens colon, then transverse colon, descendens colon, and sigmoid colon, And sigmoid colon continues into the rectum. And rectum continues into canalis annalis and opens with anus. Flexura coli dexter, flexura coli sinister, two flexura in colon. What else? Main differences between small and large intestine. Small intestine has the same layers as tunica serosa, tunica muscularis, and tunica mucosa, but mucous membrane in small intestine makes circular folds. In large intestine, semilunar or half-moon semilunar folds, plica semilunaris, and in small intestine, circular folds. Villi intestinalis in small intestine present, in large intestine, villi intestinalis are absent. Alkaline medium in small intestine, acid medium, the same like in stomach, acid medium in large intestine. But main differences between small and large intestine, they are on external surface. First of all, in large intestine, external longitudinal layers of muscles, it's not complete. It consists of 3 bundles. They have name tenia coli. 3 tenia on the surface of large intestine. One tenia is free tenia, tenia libera. Another tenia is tenia mesocolic tenia. And one tenia, tenia omentalis. Tenia omentalis. Tenia mesocolica has so name because in transverse colon, in this place, that is attachment of mesentery of transverse colon. That is why this tenia is tenia mesocolica. And tenia omentalis, because in transverse colon, here it is greater omentum attached, or gastrocolic ligament, here it is attached to transverse colon, and this tenia continues to another departments, and it has name tenia omentalis. Free tenia, tenia libera, tenia mesocolica, and tenia omentalis. They are 3 bundles of longitudinal muscles on the surface of large intestine. That is first differences. Second difference is that external surface of large intestine makes haustra-coli. They are circulation on the surface of large intestine, haustra-coli. And last external differences, peritoneum makes processes which contain fat inside. That is, a lot of fat contained processes in large intestine. They are appendices epiploidy, fat processes with peritoneum, that is on the surface of large intestine. A lot of appendices epiploidy. 3 differences: tenia coli, haustra-coli, and appendices epiploidy. That is visual differences between small and large intestine. How peritoneum supplies large intestine. Ceacum and appendix vermiformis has intraperitoneal position, but mesentery only in appendix. Appendix has mesentery, mesoappendix. Ascendens and descendens colon usually has mesoperitoneal position. Transverse colon and sigmoid colon intraperitoneal position, and transverse colon has mesentery, that is mesocolon transversum, and sigmoid colon the same has mesentery, mesocolon sigmoidum or mesosigma. And rectum, in upper part of rectum, that is pars pelvina, it has intraperitoneal position and it has mesentery, mesorectum. Ampule of rectum has mesoperitoneal position, and lower part of rectum extraperitoneal position. Canalis analis have not got peritoneum, extraperitoneal position. Rectum has 2 flexura. One flexura looks backward in direction of sacral bone, that is sacral bone, and here it is flexura sacralis. Another flexura in place where rectum pass through pelvic diaphragm, through muscles of pelvic diaphragm, that is flexura perinealis. Flexura sacralis, it's look backward, and flexura perinealis looks forward. What else? in place that is heat is diaphragm, and in place between diaphragm and flexura coli sinister we have ligament, ligamentum phrenica colicum, phrenica colic ligament, and spleen is above of this ligament. Heat is spleen. That is why this ligament makes pocket for spleen. Ligamentum phrenica colicum. What we can see in preparatory. That is terminal end of small intestine, that is ileum. Heat is ceacum with appendix vermiformis, and that is ascendens colon. Heat is, what is it? Help me. Small intestine. What is this department of small intestine? That is mesenterial part. Heat is mesentery is absent. It is, sorry. Mesentery should be here, that is, should be here. Mesentery, that is why it is mesenterial part of small intestine. Impossible to recognize. Is it jejunum or ileum? It is mesenterial part with circular ligaments. The ligament falls, of course, plica circularis. And heat is stomach, should be, heat should be cardiac opening in this place, that is fundus of stomach, that is pyloric part, lesser curvature and greater curvature. Now, spleen, that is correct position of spleen. It has superior border, inferior border, and anterior and posterior ends, extremitas anterior and extremitas posterior, and two surfaces, diaphragmatic surface and visceral surface. Visceral surface subdivides into three regions. Facies gastrica attached to stomach, facies colica attached to flexura coli sinister, and facies renalis attached to kidney. Heat is hilum lenis, that is place where vessels goes to kidney. Heat is splenic artery, arteria lenalis, and should be splenic vein. It is part, it is not a whole vein, but part of splenic vein, vena lenalis. Splenic artery, that is oxygenated blood come to spleen through splenic artery, arteria lenalis, and venous blood or deoxygenated blood from spleen goes to portal vein, vena porta, through splenic vein. And it has intraperitoneal position. One ligament start from stomach and go to spleen. Today you already know that is ligamentum gastroleonale, phrenica leonale between diaphragm and spleen, and last ligament, phrenica colic ligament, which makes pocket for spleen. Below of spleen we have phrenica colic ligament. And now let's go to corp. Diaphragm. Below of diaphragm, that is liver, heat is stomach, and that is peritoneum. From diaphragm, peritoneum goes to liver, from liver goes to stomach, from stomach, two layers of peritoneum goes downward and then moves backward, goes to pancreas, that is duodenum. It is transverse colon. It is small intestine. Sigmoid colon. It is rectum, uterus, and now. And now. Next time I will explain this diagram. It is not so important today, but if you ask me what is the differences between mesentery and great omentum, look here. From greater cavity of stomach, 2 layers of peritoneum goes downward, makes loop and goes upward. And these 4 layers of peritoneum together forms greater omentum. 2 layers of peritoneum, they contain fat vessels, and that is like blind loop in front of intestine. This structure, that is greater omentum, and greater omentum, that is between stomach and transverse colon, it is fused together, and this place, that is ligamentum gastrocoolicum, and it is greater omentum. That is two lamina, anterior lamina and posterior lamina, and each lamina consists of 2 layers. That is why 4 layers of peritoneum together makes greater omentum. And now mesentery, for example, in transverse colon, 2 layers of peritoneum which join transverse colon and posterior abdominal wall, that is mesocolon transversum. That is small intestine, and this layer, that is peritoneum between abdominal wall and small intestine, that is mesenterium. It is sigmoid colon, and these 2 layers between abdominal wall and sigmoid colon, that is mesosigma. That is why differences, greater omentum, that is peritoneum, 4 layers of peritoneum which start from greater cavity of the stomach and makes like a blind loop in front of intestine, that is greater omentum, and mesentery joined intestine with posterior abdominal wall. That is the differences. Something else?